When COVID-19 started, the Refugee Health Network Queensland was well placed to facilitate a collaborative response across health, settlement and community. So the early and rapid engagement with our community partners, especially our community leaders and advisors, was invaluable. Formalised collaboration with Queensland Health began at the end of December 2020, which then became known as the Core COVID Health Engagement Project, or CCHEP. The project was managed by the Refugee Health Network Queensland and funded by Queensland Government. It was a collaboration between 8 partners and core communities. A representative from each partner then formed a project steering group who met monthly to guide the project. Additional organisations joined the partnership in 2022. During the project, the network, under the auspice of Mata Refugee Health, was able to employ 2 part-time project coordinators and later a statewide coordinator.
Although those are already a lot of work that was happening towards the end of 2020, and that really just looked like engaging with CULT community leaders and members and working together to ensure that all of our communities had the right information in an appropriate way that they could all understand and engage with, and also knowing who to call or who to talk to if they are positive with COVID, or how to book in for an appointment for vaccination.
The CCHEP project was an opportunity for government to recognise the existing partnerships in community and work that organisations were already doing to engage community leaders and communities around this topic.
Reflecting on it, it's been about the collaboration that it's enabled us to work together as organisations, and most importantly with cultural communities.
I thought the CCHEP project was really an amazing project and a wonderful example of how government and the non-government sector and community can work in partnership together.
The resources that have been provided through the CCHEP program has allowed many touch points within community, and also make sure that they are leading the solutions around how to address the pandemic issues.
The CCHEP project also provided new channels for Queensland Health to reach communities better and quicker. One of the key things from this project was being able to turn around translated resources in a very quick time frame and get important information to community when they needed them.
The project engaged community and youth reference group from 16 different cultural backgrounds. The role of the reference groups was to advise the project and give us feedback about what was happening in the community in relation to COVID.
One of the highlights for our community being a part of the CCHEP reference group was really just having a space for us to share ideas, our challenges, and some really useful information during the pandemic. Often the solutions actually came from this group, which I think really shows the value of it. And I hope that it is utilised in many other spaces.
Specific, the way that Dr. Young conveyed her messaging, the way she spoke from the heart, the way she was able to engage with multicultural communities through different platforms. There were a lot of forums that provided feedback on how decisions were made.
Would anybody else like to say a few words?
Don't get me started.
Come on, JD.
So I think I really appreciate that what I have learned so far from this and from everyone, and being able to contribute in my capacity. And what we have learned in these 18 months, even there could be, I don't want that to happen, but even there is another COVID, I think we are ready for that.
So some community members that we were not able to connect with or get to engage, we found that with this project we are carrying on, they were able to come and join us and enjoying and bringing some friends as well. What we thought we'll do is call these meetings the African Twilight, sharing stories, sharing talents, talking about experiences during COVID as well.
For the Pacific Island community in particular, a highlight for us was just being represented. We're very rarely included in conversations like this. So CHEP really supported us in creating a video resource for the Solomon Islands Brisbane community. We not only featured in the resource and it was in language, but the production was actually done by a Solomon Islander. And so our community actually felt very comfortable to speak openly and be a part of the whole process.
Many plain English and translated resources were co-designed with communities and Queensland Health throughout CHEP. One of the key resources that was developed was a PowerPoint presentation that answered community questions.
So this resource evolved and was constantly updated as the pandemic shifted, as public health directives changed, as different vaccines became available, or as testing options changed. And the resource became the basis for a whole lot of activities, such as online information sessions when we were unable to get together, and face-to-face sessions delivered in language to different student groups in TAFEs, and in some schools, and also in different community settings. The resource also enabled the project to work with community and faith leaders to develop videos in language. For example, a nurse from Myanmar delivered information in the Matuchin language, the Afghan community leader delivered a message in Dari, a sheikh from a local mosque delivered a message in Somali, an Eritrean priest delivered a message in Tigrinya, and Congolese community leaders delivered messages in Swahili. A video was created for the PNG community and many more. The project was also able to respond to specific community questions through a video where a GP and an Arabic interpreter were able to respond to the questions.
So we have another question. How do we know that the vaccine will not cause damage to our body in the long term?
Some community members created COVID vaccine video diaries or took photos of getting the shot to encourage their communities to get vaccinated. Grace was also filmed interviewing Dr. Paul Griffin with community COVID questions, and translated audio messages were shared via social media channels.
The audio messages were actually going on very well, as people could not read and write, but listening to some audio messages. I remember when I shared one of my audio and I realized it was even shared with some of my community in Canada, and I got contacted, so that was very helpful for a lot of people.
The support that we had from the Refugee Health Network around messaging in many different languages was so useful and really helped to sort of not only for people to get the right information, because there's often a lot of misinformation, but also just to help calm people who may be feeling stressed about what's going on.
Yeah, we're very grateful for the MATA, especially the girls that help us, because we were able to send our workers back home, both from seasonal workers and Pacific Labour Scheme. And without the COVID vaccination certificate, they wouldn't be able to get on the plane pretty much.
So the CHEP in 2022 was expanded to have a statewide capacity, and we've been working closely with our project partners as well as our stakeholders to support the community across Queensland. CHEP was able to support and work with so many different communities across Queensland. Some examples include supporting the Chinese Australian Women's Association at the Gold Coast, supporting the Sikh community at the Gold Coast to run health information workshops. CHEP partnered with Health and Community Services and to support outreach vaccine clinics in different areas, such as the Pacifica and other cow communities in Darling Downs, and seasonal workers on a berry farm in Kabucha. The project supported Centre Care in Cairns to run groups and create videos in language, including young people making TikTok dances in different languages, while continuing to work with new and emerging communities such as the Ukrainian community of Queensland and other regional areas such as the Mackay.
Yeah, so we have this Facebook group, the Filipino community here in Mackay, and that's where I got the chance to share information about the latest COVID advice and how to use and get access to services related to COVID. We have 4 Asian or Filipino stores here in Mackay. And every weekend, there's an influx of Filipinos. So that is where I get the chance again to socialize and mingle with them. And I take that opportunity to tell them about the project and again, the latest COVID advice.
It was greatly appreciated by the community and our Aina Samoa, especially with the young generation that coming up and see the organizing of all the services, and it's a benefit to everybody.
So we have had 4 vaccination hubs that we attended to. I believe we have vaccinated around 200 plus workers, which was great for the workers and also for their employers. In Queensland alone, we have about 11,000 workers. So we should continue to try and help these workers.
Having the support of CCHEP has really benefited the network up here. I have been able to circulate any up-to-date information, and it's been great to invite them to the statewide multicultural Zoom meeting. They've had the Minister Jeanette Young, they've had other guest presenters presenting on COVID, and also having that direct opportunity for them to be able to participate and advocate on any local and regional issues.
So I'm working to evaluate the CCHEP project, and not just this version of the CCHEP project, but also the original CCHEP project last year from its beginnings and now into its statewide focus. We're really hoping the lessons that we learn from this evaluation will be transferable beyond COVID. Things like disaster relief or just engaging with multicultural communities more broadly across Queensland and hopefully also across Australia as well.
The Called COVID Health Engagement Project was an opportunity for government to be done differently. For Queensland Health, it allowed us to be responsive to the needs of the community by empowering them to have a voice and a say in the policy and plans that were to be implemented in their communities. We're really proud of the outcomes that everyone has achieved in partnership with the community sector.
There's been so many initiatives across Queensland, and it's been such a great experience making sure that we don't leave anyone behind.
I'm really grateful to the workers in the CCHEP project because they have worked tirelessly and authentically and genuinely with cultural communities at a time when that's really been needed. We're so grateful to cultural communities who have worked tirelessly and authentically and genuinely. And we're really excited for the outcomes of this project because we think it really shines a light on new ways forward. It's not